MPrOVE is the Michigan program for value enhancement, and we take lessons that we learn in the hospital and how we deliver patient care right here at Michigan Medicine. And we take those lessons and think about how we can scale those to research and connect our clinicians with our investigators in healthcare delivery. As clinicians and as healthcare administrators, we are entrusted with a large percentage of our nation's resources in terms of spending and dollars. We really believe at MPrOVE that value is a responsibility, and that if there are areas where we can reduce waste, reduce redundancy, and provide a better value for our patients, our clinicians, and our payers, that's our ultimate goal. Here at Michigan Medicine, we have 2 freestanding outpatient surgery centers, but also perform outpatient surgery at our main hospital. And what we know is that when those operations are done in ambulatory surgery centers, the patient experience is much higher, the clinician experience is much higher, and the cost is actually reduced. We were looking to make sure that the cases that we were hoping to do at the ambulatory surgery centers, that those patients were safe to be operated on in those locations. And what we began to consider was that for many patients, that this decision would be extremely straightforward and perhaps something that could be automated with the use of either artificial intelligence or machine learning. So what our team was able to do was to build and then test a machine learning algorithm that could predict the right location for the right patient in about 80% of cases. Our first concern, obviously, was patient safety. We want to make sure that the decision that the artificial intelligence and the machine learning is making is the correct and safe decision. We do have multiple checks throughout, even right up to the day of surgery, by the anesthesiologist who's caring for the patient that day. We saw really great results. First and foremost, we were able to schedule patients faster, and we essentially were able to reduce the physician assistant effort by about 150 hours per month. So this is rote, repetitive work that our highly trained physician assistants no longer had to do and could instead focus on those decisions that do require that expertise. That work tends to be much more meaningful to them, and I think is one of the areas that will help us reduce clinician burnout going forward, is to remove those sort of what we call low-value administrative tasks. The next frontier, I think, for work like this is that we really hope it can help tailor that preoperative evaluation for the patient. Anything that we can do to right-size the care delivery for the patient helps them avoid unnecessary tests and treatments, which can be associated with harms, but also takes into consideration the burden that they have just to travel here, maybe take time off work. And so if we can eliminate anything that's unnecessary for them, then obviously that's in the best interest of the patient.